Hello and welcome. Today's guest is Dr. Samuel F. Brown. Dr. Brown, welcome to the show.
Thank you very much.
Tell us about your practice.
Well, I've been a physician now since 2000. I went to medical school at Meharry Medical College.
Oh, really?
And then I did my residency in obstetrics and gynecology at Vanderbilt University Medical Center in Nashville. So I spent about 8 years in Nashville, and then I came to Jackson, Mississippi in 2004. And so I've been practicing obstetrics and gynecology, basically delivering babies and taking care of women throughout their entire life.
Tell us what inspired you to be a gynecologist.
Well, when you're in medical school, you go through all of the different specialties. You go through family medicine, you go through general surgery, pediatrics, all of the different specialties.
Right.
And when I went through obstetrics, I really enjoyed the the complete care that you gave to women. From from their first gynecological exam to their delivery, and then taking care of them through the menopausal period and premenopausal period. And one of the great joys I have is delivering babies. I think that is a honor to be able to be a part of people's lives during that special time in their life. So
to bring life into the world is, is
I always
special.
Say, I always say I don't bring life into the world, but I just kind of help it.
Bring it along.
I'm just there to just assist in the delivery.
Yes, exactly.
But it's a great honor, and I really enjoy it. So.
Oh, well, that is wonderful. Well, were you concerned about some women having anxiety about having a male doctor?
Well, no, I really wasn't concerned about that. I have, sometimes, there are some women that don't want a male physician. But for the most part, a long time, there weren't that many women practicing obstetrics and gynecology.
Oh, is that right?
And most recently, there have a lot more women are going into OBGYN than actually men. And so it is a challenge, though, to take care of women. And, when they have the choice, they have a choice. They can go to a man or a woman. Some women choose to go to men, and some women choose to go to women. But, I think we all give the same care. We all are trained as obstetricians and gynecologists. And women do have that choice to go to a man or a woman. But the most important thing, I think, is go to someone that will listen to you, listen to your problems, and take care of you like they're taking care of part of their family.
Exactly.
And so that's the important thing.
That's the most important thing.
The important thing is that the physician that takes care of you cares about you and cares what happened to you. What happens to you.
And I might add that when a woman is in labor, she doesn't care whether it's a man or a woman.
That's right.
She just wants
it out.
That's right. Exactly. Okay. Well, let me ask you, are you seeing a lot of AIDS in your practice?
Not a lot, but I do see it.
You do?
Yeah, and it's alarming when I do see it.
Right.
Because, we do a lot of, when we see women, especially women who are in their first trimester coming for prenatal care, we see them and we do prenatal labs on them. And part of the prenatal lab profile is to do an HIV test, to do syphilis tests, test for gonorrhea and chlamydia. And sometimes we see women come back with a positive HIV. It's not rare, but it's not uncommon to see it. It does happen. And
are they totally surprised when it happens?
Most of the time they are, yeah.
Really?
Yeah, and it's very, very difficult to sit down and tell someone that you have HIV, or even to tell them that they have chlamydia and gonorrhea, because that has a lot of implications.
Oh, really?
For their relationship. And so, so if they have gonorrhea and chlamydia, that means that somebody is not being faithful.
You said some of your patients have AIDS, some of the pregnant patients. How do they cope with the disease in pregnant?
And that's a good question. You know, how does anyone cope with the disease?
Yeah.
You know, whether they're pregnant or not. You know, when people are diagnosed with any kind of disorder, it has an effect on them mentally, and I'm sure that some people get depressed.
Yeah.
And it's difficult for people that are pregnant, people that are not pregnant to deal with AIDS.
Right.
And so I think one of the most important things to do when you initially find out that you have HIV is to seek a physician that specializes in HIV, so you can get all the correct information. You can be put on all of the newest medications that they have.
Okay.
And so a way to cope with HIV is to seek medical care immediately.
Okay.
And to seek specialized medical care immediately, and to so you won't rely on what people are saying in the streets, and you know what the real treatment is out there for you.
Right.
But even if you do that, it's very difficult. And one of the worst things to do is to be in a state of denial.
A woman who's pregnant with AIDS, can she have a healthy child?
Yes.
Oh, really?
Yes. Yes. So, and that's why it's important. So, if I have a woman comes in to see me who has HIV,
right,
or who I diagnose with HIV, I send them to a specialist who deals with HIV.
Oh,
and usually they'll start them on some medications for HIV during their pregnancy. Okay. And when they deliver, we start them on AZT during their delivery through the IV for the baby, really.
Okay.
That's for the baby. So they'll be on medications for them during the pregnancy, and during the delivery, we better give them AZT, which is a HIV medication through the IV for the baby. So yes, women who are HIV positive can have a healthy baby, meaning a baby without HIV.
Oh, well, that's good news.
Yes, that's real good news. Yeah.
That's wonderful. Okay, well, we're going to take a break right here, and we'll be right back.
Dr. Samuel F. Brown with Central Mississippi OBGYN and Associates provides all the well-woman care you'll need. Complete age-appropriate screenings, preventative care, the latest in contraception, family planning, and in-office follow-ups for abnormal pap tests. For appointments, call 601-376-2999. All insurance, including Medicare and Medicaid, accepted. Central Mississippi OBGYN and Associates. Advanced women's medicine with personal care and compassion. We're here for you before, during, and after.
We are back with Dr. Samuel F. Brown. Dr. Brown, tell me about some other sexually transmitted diseases.
Well, there are usually about 4 sexually transmitted diseases, really. Of course, we talked about HIV. There's hepatitis B, which is another virus. Herpes simplex virus. There's gonorrhea, chlamydia, and trichomonas. So how many is that? 5?
Yeah.
And you can also hepatitis C, which is a sexually transmitted disease as well. But the main ones that you hear about are gonorrhea and chlamydia and herpes. I have, in my practice, have seen a increase in the number of herpes cases that are out there. Herpes is the full name for herpes is herpes simplex virus. And usually it's the second strain, HSV2, which is the genital herpes. You also have oral herpes, which is HSV1. And the thing about it, HSV is if you have a lesion and you have a condom, you still can pass it to your partner. So condoms don't always protect you from herpes.
Really?
So if you have a lesion on your leg,
what? And
you touch someone, or someone touches you on that lesion, you can transfer herpes to them.
So that's not sexually transmitted.
Yes, it's usually transmitted through sex, but it's skin-to-skin contact.
Wow. If
you have a lesion on your genitals, if you're touching in the genitals, usually you're having sex. So that's why.
But you said on the leg, though.
Even if it's on the leg, yeah.
Oh my, what could it be on the arm?
It could be on the arm as well.
So if someone just casually touched a person not knowing what that was, they could get it that way.
They could get it that way, yeah.
Oh,
so if you see an open sore on somebody, don't touch that.
Oh, okay. Well, that's what it looks like. Okay.
Yeah, it's not just, you know, intact skin, but herpes is it's a vesicular lesion, meaning that it's like a little open sore.
Oh, really?
Yeah, and it usually occurs in the genital area. And you can give, if you ever seen someone with a cold sore?
Cold sore, yeah.
Cold sore is a type of herpes virus.
Okay.
But instead of a cold sore on your mouth, you have a little canker or cold sore in the vaginal area.
Okay.
And what the symptoms from HSV usually are painful. They're very painful, and they're even they're so painful sometimes that people or women who have it, they don't want to urinate, because if the urine touches the lesion, it becomes very, very painful.
Well,
so that's one of the telltale signs. If someone calls me and says, you know, it hurts so much when I urinate, you know, I get concerned about herpes.
Oh, wow. So is there treatment to alleviate the pain?
There's a treatment. You know, usually you start on one antiviral medication, Valtrex or acyclovir.
Okay.
But, you know, one of the things about herpes is there's no cure for it. You can treat it, but there's no cure for it.
Oh,
you
really?
can have outbreaks, and usually outbreaks occur if you have if your immune system is compromised somehow. If you get cold or whatever, you can develop a herpetic outbreak.
Oh my goodness! Well, that's scary. Well, how young are you seeing these diseases?
Well, very young.
Really?
You know, just like pregnancy, I see women who are pregnant, or young girls who are pregnant from 13 on up.
13 years
You know,
old.
and so if you're having intercourse, then you're exposed to all of the diseases that are out there: herpes, gonorrhea, chlamydia, and of course, you know, you can get pregnant if you have intercourse. So, you know, you see this in all ages.
Dr. Brown, tell us about HPV.
HPV is human papillomavirus, which is it's been in the news a lot lately.
Right.
And it is the virus that is linked to cervical cancer.
Right.
And also it's linked to genital warts, abnormal pap smears.
Okay.
And usually people that who have HPV, the virus will infect the cells of their cervix, and they can transform these cells and make them abnormal or dysplastic, or meaning bad cells. Dysplasia means bad cells. These bad cells or dysplastic cells can, over a long period of time, go to cancer, cervical cancer. That's why they say people that have HPV, human papillomavirus, cells get infected on the cervix, become abnormal or dysplastic, can go to cancer. So that's why they say HPV will lead to cancer. Now, HPV is transferred. It's like a skin virus.
Really?
Yeah, it's a skin virus. And what happens is the virus, in order for the virus to get to the cervix, it has to have a way to get to the cervix. And so in order to get to the cervix, it has to have a transport. And usually that transport is during sex. And so that's why some people say that HPV is a type of sexually transmitted disease. But it's usually from skin to skin contact.
Oh, that's interesting.
Yeah.
Well, what is the controversy around the shot, you know, to prevent it?
Well, yeah. The shot, the Gardasil shot, that's what you're talking about, right? The Gardasil shot is a series shot that is over 3 series that is used to prevent people from not being exposed to it, but if they are exposed to it, their body, it's like a vaccine. It is a vaccine.
Right.
They prevent them from contracting the HPV virus.
Okay.
And so usually it was developed for women from 9 to 26 years of age.
9 years old?
Yes.
Why so young?
Well, they're trying to catch people before they get exposed to the virus.
Wow.
And so statistics show that by the age 50, 80% of people have already been exposed to the HPV virus.
Really?
Yeah.
80%? They've been exposed, but they haven't been infected.
Well, they may have been affected but fought it off. So that's how we knew that we could develop a vaccine. We know that a lot of people are exposed to the virus, but they don't get cervical cancer. They don't get abnormal cells. And so we know that our body can fight it off and we can build up immunity against it. And so that's how they developed the vaccine.
Okay. Well,
Knowing this fact that a lot of people have been exposed to it but don't have it. But some people are exposed to it but have it. So what we want to do is give people the vaccine before they're exposed to the virus so they can build up an immunity and so that hopefully one day we can eradicate cervical cancer.
Oh, yeah, that's right. Well, you know, I have heard people say that it's so new till they're kind of afraid to give it to their young girls. What do you think about that?
Well, you know, there's a lot of research done on it, and you know, I give it to young ladies that come to my office that request it, and I counsel people on it because you know, it's a lot of people that die from cervical cancer.
Oh, my goodness.
And so, you know, you have to weigh the risk and the benefits. Is, you know, what is the risk of giving this vaccine?
Okay.
And, you know, other than some people have allergic reactions.
Oh, really? What type of allergic reaction?
Well, you know, just like any medication you take, you can have allergic reaction to. You know, if you get a shot of antibiotic, you can get a rash, or you have shortness of breath, or you can be allergic to some of the material that's in the vaccine.
Okay.
And so those are the things you have to think about.
Okay.
And obviously, because it is new, you don't know everything. You don't know what may happen down the line, what they may find that this may cause cancer or whatever.
Okay.
But
right. Well, now it doesn't guarantee to prevent cancer. It's like a percentage.
Yeah, it's not 100%. I don't know the exact numbers, but I think it's up to 80 to 90% preventing cervical cancer from 4 types of HPV viruses: HPV 6, 11, 16, and 18. Those 4 particular strains. Now, there are other strains out there that can cause cervical cancer. So, if you are infected with those, obviously the vaccine won't help you.
Okay. All right. Okay. I guess we'll take a break right here, and we'll be right back. This show is also sponsored in part by Hair Care 101, 4310 North State Street. Phone 601-982-9432. Get your business highlighted right here. Become a sponsor by sending your email to terrylynshow@yahoo.com. We are back with Dr. Samuel F. Brown. Dr. Brown, tell me, what are the warning signs of cervical cancer?
Well, to be honest with you, there are not many warning signs of cervical cancer.
Really?
However, there's a test that we do on women every year that can give us an idea whether they're at risk.
Oh, really?
Do you know what that test is?
Well, Pap smear?
Yes.
Okay.
Yes, the Pap smear is the test that we do. And the Pap smear will show whether there are abnormal cells on the cervix. And those, as I talked to you earlier, if you have the HPV virus, then they will infect your cells on your cervix. And then when you come in for your yearly exam, we do a Pap smear and we get the discharge from your vagina. And we send that to a pathologist. He looks at the cells and say, these cells look normal or abnormal.
Okay.
And so those, when we get that back, we'll bring the patient in, we'll look at her cervix closely and to see if there's any evidence of cancer. So that's one warning sign that we can, and that's very important, and that's why it's so important for women to get yearly exams.